So many of our patients have been faced with unknowns for COVID-19. This all just happened upon us in the last few weeks,
Yes.
and they're already experiencing stress just from a diagnosis with prostate cancer.
Mhm.
What are your thoughts on how patients can manage their additional concerns and stresses based on COVID-19?
Yeah, what a great question, and thank you for asking that. We're speaking on a lot of different reasons about how this is affecting cancer patients, Patrice. And one of the things we're feeling is cancer patients will often tell us, I feel like I'm fighting a war on two fronts now. I'm trying to deal with and cope with whether it's a new diagnosis of prostate cancer, whether I'm in the middle of treatment, whether I'm post-treatment and in follow-up. And here comes this tsunami of worry and concern. Life is really different. There's a few tips absolutely we can give you right off the bat. And the first is, and you'll see my eyes looking to the side as I make sure I wrote a little list I want to share with everyone. And I want to make sure I include it. And the first one is right at the top of my list, constant stream of information needs to be controlled.
Mm.
There is so much information coming at us from a variety of places. The TV, the internet, Facebook, our friends, the newspaper. And what's it all about? COVID-19. So we need to step back and look at how much time we're taking this information in and how can we cut back on that? Because that's definitely adding to the stress and the fear.
Absolutely. Even in my own life, what I've seen is I always wake up with a morning news show. But because it's all about COVID-19, I don't do that anymore because it really does increase your stress when that's all that you're taking in.
Mhm.
So, what would you suggest that folks should take in instead?
Well, great question. And it really goes to so many different parts for that question. What should they take in first? Well, the first thing is, as in any life, they should take in moderation. How are you spending your day? Now, many of us around the country, myself included, are stuck at home. We have been advised by our government to stay in. I'm working remotely. So, how am I managing my day? What does my day look like? Along with the fact that I want everyone who's listening with us to try to cut back on that news time and that social media time. At the same time, I really want to encourage you all to keep a schedule.
Hmm.
We find that people who follow a schedule manage their day-to-day mental health better than those who don't. You know, it's interesting when they're working in programs for people who are drug addicts or alcoholics. The first thing they teach them, first thing, get up in the morning, brush your teeth, wash your face, make your bed.
Hmm.
Why do we do that? Because a routine allows us all to have structure and confidence in what our day is going to be and look like. We're not all over the place. We know what we have to do. So limit that exposure to the news. Get up and have a routine. Start your day just like you would any other day. So those are two things we can do.
Oh, that's great. And it's interesting because in thinking about structure and routine, because things are so different now, I'm finding that the routine can be different too. It doesn't have to be that you get up at 7. Maybe now you're going to get up at 9, but if that works for now, then that's okay, right?
Listen, it's always okay. Everything's always in moderation. There's never, ever, well, there is in certain places hard and fast rules, but in general, in our lives, we should always have a little give and take in what we do. But the truth is, we really do want to stick to a routine. And we want to make sure that within that routine, we are doing things like exercise. And I'm not talking about running a marathon here. I'm talking about some simple, easy exercises because we know for a fact that stress can affect you physiologically. It affects your body. It is not good for you. I was looking for a quote I wanted to share with you all, but it really, really was a great quote. I don't see it right now, but it is from MD Anderson, one of the premier cancer centers in the world, where they talk about the effects of stress on your physical being. So limit that time that you're getting information that's coming at you about this virus. Keep to a routine. Know what you're going to be doing that day. And here's the third thing. Go for a walk.
Mm.
Go for a walk. If you can't walk, move your arms, move your head, move your body. Where are your shoulders? We do this all the time. We walk around where I work and I'm always going like this to people because there's the shoulders. They're here.
Yes.
Want those shoulders here. Get some of that stress out.
Mm. There's something about posture, right? When
Mm-hmm.
you're upright and you're breathing in well, you just feel better, regardless of what's happening.
Absolutely. And here's the thing, when you do this, you're collapsing your diaphragm. You are not getting in the air that you need. And of course we breathe to live. But breathing, there's this old, almost hippie saying, I guess it's a yoga saying too, which is about the cleansing breath.
Yeah.
But really, really, what that means is you are just settling your whole body down. So for everyone who's listening, this is so simple. Everyone can do this, from the 3-year-old to the 93-year-old. And that is, where are your shoulders? Get them away from your ears, get them back. 3 just cleansing breaths. In through your mouth, in through your nose, out through your mouth. You don't want to do this. You'll hyperventilate, you'll pass out, and I'll have a terrible reputation. Please don't do that. Simple breaths, just 3 of them, every so often. Double check, where am I? Where are my shoulders? Where's my chest? Where's my neck? And am I breathing? That's all.
That's all. Okay, that seems simple. It seems like almost anyone can do that, right? We can breathe.
Absolutely.
And we can lower our shoulders.
Absolutely.
Yes.
Good
All right.
start. All right, what else?
So we've all been hearing that we need to social distance. And part of what's happening is that patients aren't going in to see their healthcare providers because there's such a strain on the healthcare system. So how would you suggest that patients and their families work within the anxiety that they may be feeling because they're not able to go in and see their healthcare provider when they're dealing with a cancer diagnosis?
Mm-hmm. Mm-hmm. So the reason you saw me reaching and you see me looking down is I'm reaching for something specific, and you all can't read it, but I want you to see that it's real and it exists. This is a printout from the National Comprehensive Cancer Network, the NCCN. Now, everybody listening, you can go and read this. All you have to do is go to nccn.org, and there's a little search bar at the top. Type in prostate cancer patients, because you want the patient portion. The physician portion, it's like someone speaking a foreign language and we can't interpret it. We want the ones that you and I will understand. And if you do that, what this is going to tell you, by and large, is guess what? Your physicians, your nurses, your hospitals, your cancer centers, everyone who cares for you as a cancer patient are all talking to each other about what do they do if they can't see you in person. So the first thing I want everyone to know is you're not alone. Your treatment providers, your healthcare team, absolutely know what they need to do or what they shouldn't be doing when it comes to this time of social distancing. If you are getting a call from your physician or the physician's nurse or the physician office saying they're going to delay your appointment, I want you to feel secure and comfortable that they wouldn't do that if it wasn't okay, that they wouldn't do it if the National Comprehensive Cancer Network didn't say, this patient has this prostate diagnosis, is getting this treatment, is at this point in their care, it is okay to wait this amount of weeks or months before you treat them. They are on this. This is a huge, huge discussion in the cancer world with your physicians. Now, that being said, it's still scary when your doctor says, oh, I don't need to see you. We're going to wait a while. So, rule of thumb, what are you scared about? What are your questions? Write them down and then call and let the office know, listen, I understand that I'm not going to be seeing my doctor, but I have questions. Can we do a virtual appointment? Mm-hmm. Because around the country, this is how patients are being seen, cancer and otherwise. If we don't need to give you a treatment where you have to be there, and we don't need to touch you to figure out what's going on, that verbal is okay, then we can do what you and I are doing right now, and what everyone listening to us hopefully is experiencing. We can have a dialogue virtually and talk about it. So write your questions down and ask your doctors about it.
Thank you.
You're welcome. The other last thing I want to say about this is prostate cancer is one of the very, very few cancers that by and large, remember, no matter what the cancer diagnosis, cancer is a disease of statistics. That's how we figure out who do we treat, how do we treat, how long do we treat. It's based on statistics. So statistically speaking, the majority, over 85%, the majority of prostate cancer newly diagnosed, is not diagnosed in an advanced stage needing immediate treatment. So if you're newly diagnosed, deep breath, there really should be no problem with waiting weeks or even a few months to start your treatment. That's the discussion to have with your doctor.
So really what I'm hearing, it's about trusting the guidelines and that the doctor will be in communication with the patient and their family when there's further action that's needed. But for right now, it's just about taking a breath and understanding that they're in good care, right?
That's correct. And again, it really, really is helpful. Write your questions down. Write them down so that you have them ready. And let everyone join in. Your significant other, your adult children, your teenage children, your parent, whomever it is, the person that cares about your persons. Let them add to that question list so that you can speak with your healthcare provider. Say, well, here are my questions. And really, let's think about it. What's the biggest question everyone wants to ask when they're told, I'm not going to start your treatment right now? Wow, is that going to affect, am I going to live or die? If you don't give me the treatment right away, what's going to happen? Ask it. Don't be afraid to ask that question. Here's the other thing. If you're in the middle of treatment, they are not going to stop your treatment. No one would do that, okay?
Yeah. And you bring up a good point about asking questions. I feel like sometimes we hear that folks are sometimes hesitant to ask questions of their providers. Do you have any suggestions for folks how they can get over or move past being afraid to ask questions?
Sure. It can be cultural. There are certain cultures where you don't question authority. It's considered rude. So if you're part of that culture, we will find that often in certain Asian cultures. There's this respect, almost downcast of eyes when someone above you, a professional, a doctor, is speaking. And you just do that quietly. So check for yourselves or for your loved one, is this a cultural thing? Then I have to be honest, I'm kind of in that group now. Older folks come from an era when you don't question authority. The doctor is always right. Leave it to the doctor. And often you'll have adult children or grown children or late teens children going, why don't you just ask the doctor that question? Yeah. And you're thinking, well, he's the doctor, she's the doctor. They know best, or if it were important, they would tell me. But in this day and age of medicine, it's a give and take. It's a dialogue. Your doctors want you to ask them. They need you to ask them. And you, for your own sense of well-being, need to be participating in your healthcare and asking the questions you need to ask. But here's the one caveat for everyone. There is a whole small but real subset of people that don't want to ask because they can't handle the information. It's too much for them. It's too frightening. And we have to respect that as well. And if you have that kind of parent or that kind of person in your life that's pushing back and not asking, ask them if you could ask the question for them instead. Would that be okay with them? And how much information do you want me to share with you, Dad? If it's okay if I ask Dr. Smith this, that, and the other thing, do you want me to share everything? So we're respectful of those people who, if we give them too much information, it's just going to crumble. They just can't cope right now. That's an important difference.
Mm-hmm. That really gets to sort of patient-centered care and what the patient wants, right? And being in that way. And it seems like that kind of care is what helps alleviate some of the burden for the patient, right?
Well, certainly we hope so. That's what medicine is about today. It isn't about telling you what to do what you're told, end of discussion. Listen, the guys and their loved ones who are hearing this presentation today, they know this. The bulk of them were given different options to treat their prostate cancer, and they were told, choose one. And I hear all the time in our prostate information and support group the response going, I'm not the doctor. How come they're asking me to choose my treatment? That's
Right.
kind of weird. But it isn't, because prostate cancer is one of the, again, very few cancers that, depending on the stage, but the stage that most people are diagnosed at, there are a variety of treatments, neither better than the other. So you have to choose. How do you choose? You have to ask questions. You have to be comfortable communicating with your healthcare team, or get a proxy, someone else to communicate for you.
Ah, the power of loved ones and caregivers, right?
Absolutely. Absolutely.
So with COVID-19, because so many folks are self-isolating and social distancing, we're
Mhm.
hearing that folks are feeling isolated. Um, what are your thoughts on how people can stop feeling so isolated and disconnected from the world?
Well, again, certainly there is all of the virtual connections, the social media and social platforms for those of us that use it, that is available. And I really urge those of you who've never done that before to consider it. It's really simple, and it doesn't have to be this fancy, although this is kind of nice, isn't it? You're
It
sitting in
is.
one place, I'm sitting in another place, everybody's talking to one another. That's wonderful. And some people can do that very easily. Others can't, but they can pick up a phone, push the speaker dial, and call, and just put the phone down and talk to one another. Just about every single phone in the United States today has a speaker button. Now, those are, listen, Facebook, FaceTime, get on your phone, all of that makes a huge, huge difference. And then if you're still feeling really isolated and you find yourself not coping well, you're never getting out of pajamas, you're not getting out of bed at all, you're eating way too much or way too little and not eating at all, those extremes, that's a sign of depression. That's different. Feeling isolated is one thing. That's a lonely feeling. We don't like it. Most people by nature, most humans by nature, like to interact with other humans, right? That's different. That, use all those social media. Do you go for a walk if you're physically able? It's okay. Put that mask on, go for a walk. You can wave at your neighbor. You can yell at one another if you like. Do the things you have to be proactive about that. You have to take care of yourself. No one's going to knock on your door and take care of you that I know of unless you ask for help. So that's the final piece. If you're so overwhelmed with what's going on and you're feeling these huge highs or huge lows, like I said, extremes, that's the time to ask for help. It's important to do so.
So one of the things that I often hear is folks don't understand what a social worker can do for them. And sometimes they don't even know that they have one available to them within their healthcare
Right,
system.
right.
Can you talk a little bit about that? What is the role of a social worker and how can they help at times like this?
Well, thank you for asking that. This has been my career and my passion my entire adult life. And there's a few things to know. The first is that there's lots of different types of social workers. And the social workers most of us have known about or hear about or see in the movies or see on TV or read in the newspaper, those are community social workers. They're working in community agencies. And so oftentimes we have a misconception of what an oncology social worker is, because that's a very specific, trained subset of social worker. So oncology social workers are there to help you with a variety of different things. They're there to help you with what we call concrete needs: transportation, food, lodging, all of those everyday living needs. What's going on? Can't work anymore. What do you do? Has the paperwork been completed properly to get you whatever assistance that you need? What assistance do you qualify for? All of that's really straightforward. Social workers should know that, be able to give you that information at the drop of a hat. If they don't know it, they know where to get it quickly and share it with you. So that's what we call the concrete needs. But the other, remember, it's called psychosocial needs. So that's the social concrete part. The psycho part, not psycho crazy part, the psychological part, the part that oncology social workers are most trained and capable to help with are: how are you coping? How are you feeling? What is going on with you? And really, it's so important. And you know, this group of cancer patients, prostate cancer patients, are, for me, being in the field for over 40 years, not just the most rewarding to work with and learn from and grow with, but also the most challenging. Because whether you're the outlier or not, by and large, most men aren't so easy about talking about feelings. They're the strong ones. They're the ones that mommies and daddies said, "Suck it up, kid. Be a man. You can do this." And if you're that kind of male, then asking for help can be difficult. And it can be especially difficult to ask it from people you know, from your family and your friends, because they have one vision of you, and you would like to keep that going, that vision. This is extremely, extremely important, and when you should reach out for the social worker. Because they aren't your family, they aren't your friend, they aren't your significant other, they are not going to judge you or see you as needy. They're going to say, "Okay, well, let's talk about this. What's going on? What's happening?" "Well, I find that I'm really angry all the time." "Okay. Share with me an example of what that looks like." "Oh, really? Okay. And how come? What happened before that?" "Well, let me ask you a question. Before you had prostate cancer, was that your reaction also?" See how the dialogue goes? Let's really talk about what's going on. And then your oncology social worker is going to do one of two things. Well, you know what? They're going to give you some concrete information. They're going to give you concrete suggestions on what to do, how to change. Or they're going to say to you, "It sounds to me like maybe some short-term psychotherapy might be needed. Let's talk about that. How do you feel about that? Can I help connect you with someone? Maybe they already offer that in your cancer center." So important to say, do I need that professional's ear? And how do I get to them? Make sense?
That makes total sense.
Good.
And what's interesting is I'm wondering if you can speak to this. I don't think it's fully known that cancer patients go to therapy because they have cancer. People don't always put that together. Can you talk a bit more about that?
Well, I can.
Yeah.
I can, because what's the 3 words no one ever wants to hear their doctor say to them? "You have cancer." Isn't that amazing? You know, no one says to me, "Oh, I never want to hear the doctor say, 'You have diabetes,' or 'You have high blood pressure,'" even though nobody wants to hear that. Nobody wants to be there if they can help it. But nobody goes, "Oh my gosh." But we do that about cancer. So yes, absolutely. You know, it is the one area in medicine that if you want to be an accredited cancer center, you have to have oncology social workers on premise, full-time, available to work with your patients. They don't say that about an orthopedic center, about a cardiac center, about diabetic center, only about cancer centers. This is hugely important, and it's very telling. This is a frightening diagnosis. Even though we like to joke sometimes and say to prostate patients, "Okay, the bad news is you have cancer. The good news is you have prostate cancer." Because it's very treatable. If it isn't curable, it is certainly treatable. And we know men with advanced stage prostate cancer who live active, good lives for 10, 15, 20 years or more. So it's still cancer, and it's still frightening. The other thing is, cancer is a diagnosis of the whole family. It's not just a diagnosis of the individual, and it affects the family in a very, very different way. So all in all, this is a diagnosis. This is the one time in medicine for sure that everyone agrees, a social worker could be really helpful in walking through this.
Mm. Well, thank you for what you do. It's certainly important to men and their families and even beyond, right? Because without social workers and guiding patients not only to resources externally, but then helping them with themselves kind of get through this, I don't know where we'd be. So very grateful
Well,
for
thank
the
you for that.
um, so to close out, what would you say to caregivers that are going through COVID-19 with their patients right now and wondering how they can take care of themselves, right? But also take care of their family member, their loved one. What advice do you have?
A few different things. The first thing is this will end. While we may not know when, this will end. There will be a time when it's over. And we will be, I don't know what back to normal means because we don't know what the world's going to look like when this is over. It will be different, but it will be over. So you said it perfectly. After understanding that this will end, it does have a finite point. Next thing is, if you're a caregiver, a caretaker, the loved one of the prostate cancer patient, you need to take care of yourself. If you don't, and you're all stressed out and you're not caring for yourself and you get sick, then what's going to happen? One person cannot meet all of your needs and vice versa, right? It's just not possible. It's a setup for failure. So a little distance from each other is a good thing, not a bad thing.
So we've heard a lot about how to manage anxiety and how to manage boredom. Are there some things that folks shouldn't be doing now while they're at home?
I'm so glad that you asked. Absolutely, there are. I think we've seen that people are, I know I have certainly seen some jokes about it, some seriousness about what people are calling the COVID-19 pounds they're gaining because they're bored and they're at home. But we really, really do want to caution everyone, but particularly our cancer patients, and then over particularly our prostate cancer patients, about eating or drinking too much. Really, putting on weight when you're a cancer patient is not a good idea unless you're one of those patients who's losing weight because of their treatment. That's different. We're not going to talk about if you're underweight. That's unhelpful. But we don't want you putting on weight. Men tend to put on weight in belly fat. There's been a lot of connections between belly fat and prostate cancer. We don't want you doing that. So please be cautious and careful. You know, that extra bowl of ice cream is not helpful right now. When you go to reach for that second bowl, step back and go, let me see if I want it again in 20 minutes. Let me walk around the house and do something else. Usually you really don't want it. It just takes a while for your body to go, oh, that was good. I had enough. We'll go right for the second helping when we don't really need it. So that's one thing. The other I'd really like to caution against is alcohol and too much drinking, because it is a time, again, some people think they're depressed, or maybe they're having trouble sleeping, or who knows what, oh, cocktail hour, must be 5 o'clock somewhere, and we all laugh and joke about it. But here's the truth. The consumption of alcohol has been directly linked to numerous healthcare problems, including an increased risk of certain cancers and not doing well with the treatments of other cancers. Am I telling you, do not drink? No. No one has come up with an absolute scientifically backed clinical trial that says you may not drink at all. However, moderation is the key here. Real moderation is the key. What does that mean? Well, the American Cancer Society said if you're going to have to drink, it shouldn't be more than 4 ounces of alcohol a day. And that is whether it is beer or wine or hard spirits, it doesn't matter. So no more, and here, you may not save those up and have them all Saturday night either, okay? That is not allowed. So if you have to drink and you're going to drink, we really, really suggest you do not more than 4 ounces in a day. And be careful and think about that before you reach for that alcohol.
I thank you so much for your time, but more importantly, for your perspective. This has been immensely helpful, and I know men and their families across this country are going to learn so much from you. Thank you for your time.
You're very welcome. Thanks for including me. Bye now.
Hello, everyone. I'm Xero's President and CEO, Jamie Burse. I hope you're learning a lot about prostate cancer and Xero's programs during our special Giving Tuesday coverage today. I want to take a moment to remind everyone that when you donate today to Xero's COVID-19 support fund, all of your donations are doubled thanks to a generous match. And no donation is too small. All of your generous gifts allow us to help more prostate cancer patients and their families during this pandemic. So please donate here on Facebook or at xerocancer.org. Our special Giving Tuesday coverage will continue in just a few minutes.